What happens to hospitals during load shedding? How does load shedding affect health? And why are hospitals not exempt from load shedding? Hello and welcome. I'm your host, Dr. Musam Tomeni, and signing with us today is Trifosa Nzolenge. On Vital Signs, we'll focus on the impact of load shedding on the healthcare system in South Africa. Coming up on the program, we'll hear from acting CEO at Bheki Mlangeni District Hospital on how they cope with load shedding and patients who are affected by load shedding at home. We'll listen to an insert of a family from Vereeniging who lost a loved one apparently after an unscheduled power outage. We'll also listen to an insert of an 18-year-old teenager living with oxygen and is oxygen dependent, and her fears whenever there is load shedding. And we'll speak to the head of internal medicine from Maxeke, Johannesburg Academic Hospital about the impact of constant power cuts on the healthcare system. We'll speak to general practitioner about how load shedding has affected his practice and, of course, patient care. And lastly, the chief director of primary healthcare from the National Department of Health about the devastating impact of load shedding on Gauteng's public hospitals as well as clinics. Remember that you can be part of the show by asking the guests that we'll have on any question that you have on your mind. Simply share your view with us on what we're discussing. The number to call is 011-714-5861 or 011-714-5877. Also available on social media, on Twitter at SABC Vital Signs or Facebook SABC Vital Signs. The show continues and we want to hear from you. All you have to do is contact us. We'll see you after this ad break. Welcome back to Vital Signs. Now, something fewer people would have experienced is the moment that the power kicks out. But rather than this being your house, it's actually a hospital room or theatre, and they're plunged into darkness. Producer Wandile Mufokeng filed this report to find out how some hospitals are coping during these tough, dark times.
More than 80% of South Africans are reliant on public health care services, while private facilities and tertiary-level public hospitals appear to be well equipped with generator banks. Smaller healthcare facilities are often left in the dark. Power failure and the lack of a robust contingency plan could prove disastrous in any healthcare environment, with diverse and far-reaching consequences. To get a clear picture of how load shedding impacts health facilities, we visited the Bheki Mlangeni District Hospital in Soweto and spoke to the acting CEO, Dr. Thulani Mngomezulu.
As the hospital, we are also affected by the load shedding. We are not exempted. However, up until now, we haven't been severely affected because we've got our emergency generator, which is built-in for every facility, health facility, which kicks in within a matter of seconds when the electricity from the grid is cut off.
Hospitals are required to have a backup diesel generator, which turns on in seconds after an outage, and are not meant to run more than 3 days.
In this region, we did have an issue of a substation that blew out, and it took about 72 hours to be fixed. And that is the longest time that our generators has actually been able to run and service us.
Tertiary hospitals provide care for a large number of critical ill and injured patients, who often require the use of multiple electronic devices. Fortunately, the hospital has a backup plan for these devices when there's load shedding.
Majority of our equipment, like our ventilators and other things, they do have UPS, which is the uninterrupted power supply, which will bridge that gap when the electricity goes so that the equipment is not affected.
Approximately half of South Africans live below the poverty line and therefore lack the financial resources to obtain safer alternatives to electrical power. As with Karabo Baloyi from Soweto Meadowlands, who was diagnosed with a lung health condition that requires her to be on oxygen cylinder 24/7.
In 2013, I was diagnosed with positive bronchitis, which causes a TB. So that positive bronchitis, it happens ukuthi ivule imbobo on my lungs.
Tell us about the machine that you use. Are you required to use it 24/7? And what are you using the machine for?
I'm using the what is called a concentrator, which is a big machine esebenzisa electricity. Iyo enceda ukuthi ngiphefumule a bit better.
Have you ever been admitted due to load shedding?
Yes, I have. But then manje bagcine sebengijikisa because but people are sleeping there and I can't be there while I'm not sleeping.
Dr. Tulani acknowledges that load shedding impacts patient care, particularly for those who are recovering from home. And they have seen more patients being admitted due to the lack of power at their home.
There's load shedding in their homes. They tend to run out of their oxygen supply very quickly, and they end up coming to the hospital because of the issues at home. So we get more patients getting affected at home by load shedding coming to the hospital.
After the break, we'll show you an insert of a family from Vereeniging who lost a loved one apparently after an unscheduled power outage. We'll then speak to Professor Adam Mohammed, the head of internal medicine from Maxeke, Johannesburg Academic Hospital, about the impact of constant power cuts on the healthcare system. Stay with us. Welcome back. Here on Vital Science in SABC 2. The impact of load shedding on healthcare. A Vereeniging family is reeling after the death of their loved one, apparently after an unscheduled power outage. Willie Munting, who was on a home-based care ventilator, struggled to breathe and was later declared brain dead. Munting died on Saturday, the 25th of June, whilst the country was on stage 4 roading blackouts. Griselda Lewis filed this report.
I wish I could show people the panic that I heard in that mother's voice when I spoke to her on Saturday. That is something that I will never, ever in my life forget. Never.
Struggling to hold back tears, the Peacehaven community believes Willie Munting's death could have been avoided. They claim an unscheduled blackout was the cause.
This really hit very hard. I've known Letty and Willie for many years. And if you speak to, we can only empathize up to a point because we do not really know what they are feeling. But as mothers, we can understand why they are as angry as they are. As you've seen, they are extremely angry and emotional because this was an unnecessary death. It shouldn't have happened. Willie was 44 years old. He was still a young and very able man. He was never a burden to his mother or his fiancée. For me, I can't help being emotional because I was the first one to hear about it. I was in communication with his mother as much as I possibly could be in between everything else that needed to happen. And yes, it hit us hard.
While his family has been too distraught to speak to the media, the country continues to grapple with rolling blackouts. It's literally a struggle to survive.
Unfortunately, due to the continuous power outages that happen in Peacehaven, we found ourselves in a situation where we lose a life because of the incompetence of the municipality. One might ask, what does the municipality have to do with this? Firstly, the municipality has contractors who are paid thousands of money to repair electrical outages. However, in this particular week, the contractors came 5 times to repair one issue that continued to persist and be a problem. And therefore, this is why I say this is also reliant, this is heavily on the incompetence of the municipalities.
Willie is expected to be laid to rest on Monday. Griselda Lewis, SABC News in Vereeniging.
Continuous power cuts have a devastating effect on South African hospitals as well as clinics. Moreover, it affects patients with specific healthcare needs. Hospitals are unable to cope in the way that they need to during load shedding, and people's lives are at stake as a result. We're now joined by Prof. Edem Mohammed from Johannesburg Academic Hospital, who is the head of internal medicine there. And we're going to discuss the impact of these constant power cuts on the healthcare system. Thank you so much for joining us, Prof. Let's talk about, where we find ourselves now. I think, as a country, with the suspension of load shedding, things are starting to look a little bit better. But we've just come from a very dark period where load shedding was upgraded to a level that was stage 6. So how were, operations affected during this time?
Thank you so much for having me on your show. I think it had a major impact in tertiary hospitals, and your inserts did highlight the bigger hospitals have generators, the clinics and lower level hospitals don't have generators. So patients are turned away and then they have to come to the tertiary hospitals. And in a system that's already overwhelmed, you're having many more patients that should not be at that level of care coming to that hospital, and you can't turn them away. Remember, we have lots of patients who are advanced illnesses that are on ventilators. Yes, we have batteries and backup powers for these ventilators, but the more you utilize it, the more you have uninterrupted power, the more you have outages, the damage goes on and on onto these batteries. And there have been instances where the generators at this hospital did not kick in an appropriate time, and it did cause such immense chaos and panic. Remember, infusion pumps, even water in the hospital is dependent on electricity. Dialysis machines, people have interrupted care for the dialysis, and machines and tubing gets blood clots, and then you have to redo the entire thing. And remember, the budget to run these generators, to maintain those generators, comes from your fixed amount that you allocated every year. So if we're putting into millions into generated diesel, like Baragwanath spent almost 3.5 million in 1 month just on diesel, where does that money come from? It comes from patient care. We're taking away money from other aspects to run generators so that we now take money away from patient care. Operations are affected, especially if there's unscheduled. And when we do have scheduled, we make sure that we're not doing critical care, anything of that sort that will compromise patients. We did have incidents where generators did not kick in while we were busy with a resuscitation. It does affect outcomes of patients. And our equipment is so fragile, we have challenges. Give you an example: MRI scanners, CT scans, computers that go off and on. Takes a while to restart up. And in that time, you don't have access to imaging results or anything of that sort. And constant utilization of generators put them at increased risk of catastrophic failure. And we have challenges of servicing and maintaining machines. And when this happens, we are heading for a disaster. And to give you an impact, Western Cape, the hospitals are excluded from load shedding. We know this. Why are we always reactive and not proactive? I think we need to make our hospitals exempt from load shedding as a matter of urgency. And I do know Gauteng Department is looking at this, but we've been having load shedding for years, yet we're still thinking about what we should be doing. This should be done like yesterday. And I know there's lots of issues and challenges, but it's affecting patient life. Quality and quantity of care is being affected, not just at tertiary hospitals, at every level of healthcare. Regional hospitals, district hospitals, clinics are being affected. And it's sad when you see the case of that young child with oxygen, the person who died at home. These are preventable deaths. And that's what I'm going to tell you. Preventable deaths. And you can't blame load shedding. It's poor management and poor acknowledgement of the challenges that the hospitals are facing.
Now, these issues, and I guess someone could have an argument to say that the power only goes out for 2 hours at a time and then is back up for the rest of the day. But what kind of effect does this have, for instance, on outpatients, or, like you've mentioned, on patients that would require reports from CT scans and things such as that? What do the daily operations actually have in terms of an impact due to this 2-hourly outage that would occur?
So patients leave home 4 in the morning so they can get to hospital early. 4 in the morning, dark. You come to the hospital, it's dark, you can't see the patient. You're using your phone torchlight or you're using some emergency light to look to see the patient. Patient is coming back and needs blood results, need x-ray results. Sorry, I can't help you. You must come back another day. You already have a booking system that's already anything from 6 weeks to 6 months. So when does that patient come back into the system? Does he wait another long 2 to 3 months before you get answers for results and further testing? You're waiting to do a simple endoscopy. That's my background. I can't do an endoscopy on you today, so you'll have to come back. So you starved yourself for a procedure, and then you must come back. Again, you're waiting 3 to 6 months. On a background of 2.5 years of COVID, with an immense backlog of giving people critical care for services and investigations. So it's a continuous setback for patients for the last 2.5, 3 years. With COVID, and especially my hospital, the fire and bungling of fixing it up, and now you have load shedding. It's just not fair on patients who are requiring tertiary and quaternary care. And I want to highlight Baragwanath Hospital, Helen Joseph Hospital, Rahima Musa. These are referral hospitals with patients that are critically ill. And we have a lot of medical legal bills that we're paying because of patients dying. And I think load shedding can limit these aspects for our care if we have good planned sources of power and take us off the grid for load shedding.
So in an ideal world, especially on the back of what you're saying now, take us off the grid, what does that look like for you? I mean, I think you've mentioned and started to, talk about this idea of having the hospitals being exempt from being load shedded, coming off the grid. But in an ideal world, what would you like seeing happen in the short run?
In the short run, I think we need to make sure that we have a generator for a generator. Uninterrupted power supply 24/7. No negotiation about that. And to be honest, I'm very skeptical about how we're going to overcome load shedding in the near future. And we maybe need to invest in public-private partnerships with solar powers and lithium batteries. We must do whatever it takes to make sure the vulnerable healthcare patient is protected, even for a fraction of a second. There is no cost that you can put onto a patient's life. It doesn't mean if you're poor and vulnerable, we can play Russian roulette with your life. And that's my challenge to everyone. Let's stop playing Russian roulette with poor and vulnerable people's lives that are already getting up at 4 in the morning. And you're coming here and you're not sure if you're going to have your procedure canceled or interrupted by power supply. And remember, for lots of tertiary buildings, theaters, air cons, airflows, all of this is linked to infection control. It's linked to infections, preventing hypothermia. Can you imagine a building that's freezing cold and you're having a 2 or 3 month old baby having an operation done? And this is what we're dealing with. Freezing cold buildings in an environment where the vulnerable, neonates, children are already at a compromise and we're further compromising them. Remember, you can't give warm food to a patient during load shedding. That has an effect. I know it sounds, what are we complaining about warm food? But nutrition is a basic necessity of healthcare. And you can't give someone a cup of tea or milk because you're out of electricity for 6 months, 6 hours to 8 hours. It's sad. And we need to look bigger at how can we make the life of the most vulnerable patient in a hospital safer and better. And we need to come up with public-private partnerships now.
So a lot of people, when they experience load shedding and they hear that there are generators at the hospital, would assume that the power is distributed throughout the hospital. But I'm assuming this is not the case, where power is only given to specific areas where that power is very necessary. So how does it work at your hospital with respect to getting this redistributed generator power?
So you're 100% right. It's redistributed according to emergency red plug lines. So the generators do not supply the entire hospital. It supplies certain areas that were designated as high-risk areas, for example, ICUs. But remember, this hospital is over 20, 30 years old, and the design was what was happening at the time. Over the last 20, 30 years, new wards have created up, new ICUs have been put into different areas. So you have areas that are not on the red line system, but yet they are in critical service delivery. So you're compromising that those patients in those areas. So again, each time you want to upgrade to more red lines, you need more generators, more emergency backup capacity. And at the end of the day, what the generators are doing is providing the barest minimum to areas identified, but has not kept up with the time and intensity of what the hospital is doing currently. Not all the theaters are linked to the red lines. So all of a sudden you have an unscheduled visit or unscheduled power outage. You're in chaos and panic.
And lastly, Prof, just before you go off, I'd just like to find out from you, is there a number that has been worked out that is actually required to take us off the grid that you know of, just so that the hospital, and your hospital specifically, doesn't experience this load shedding?
So I can't do that and speak on behalf of my hospital because I think it's wrong. I'm speaking on behalf of all healthcare facilities.
Okay.
Someone who comes to a clinic who's ill gets seen and then referred to a tertiary hospital. So I can't give you a number for my hospital. All I can say is, as a general rule, our Gauteng Department and Gauteng Department of Health needs to come up with a solution for all healthcare facilities. Let me give you a practical example. Every single bank branch has a generator. And now they're moving to storage of extra water. So if the bank can have a generator for every branch, why can't we have extra backup power and be taken off the grid for healthcare? Surely that's the most important aspect in this country.
Well, thank you very much, Prof. Adam Mohammed, the head of internal medicine from Charlotte Maxeke Johannesburg Academic Hospital, highlighting the problems as well as the possible solutions that he thinks need to be laid out to ensure that hospitals are protected from load shedding. After the break, we'll listen to an insert of 18-year-old teenager who is living on oxygen and, of course, fears for her life whenever there is load shedding. Then we'll speak to Dr. Marlon McKay, a GP, about how load shedding has affected his practice and patient care. Stay with us. Inako Kewana from Densani in the Eastern Cape developed a lung disease which affected her breathing ability in 2018. The 18-year-old teenager who survives on oxygen concentrator lives in constant fear owing to load shedding. She uses an assistive device to breathe which relies on electricity supply. She fears for her life whenever there is load shedding. Reporter Lubabalo Tata and cameraman Tobani Blom visited her family and filed this report.
Forced to quit school at an early age due to her deteriorating condition. Inako Kewana's life depends on this device. It must be plugged in a power supply all the time for it to work.
I
would get sick while at school and cough non-stop. Even at night, I would cough and my mother would call an ambulance, and I was advised to quit school.
The condition has robbed this lady of her childhood. Breathing is still a problem. Inako also can't play with her peers. She spends most of her time in bed or sitting on the couch. Her dream of becoming a lawyer is shattered.
I can't do the things I used to do. I can't even walk normally. I develop short breath after a few steps, even though I'm having this oxygen.
The oxygen concentrator runs continuously and requires electricity. This puts a strain on the family's already stretched budget.
The machine uses a lot of electricity. My mother borrows money from loan sheikhs every month so that we could have electricity. And then she must pay back the money.
Load shedding is a threat to Inako's life. Her family must make alternative arrangements prior to the scheduled power cuts.
If there's going to be load shedding, my mother calls the hospital 2 hours before to arrange an ambulance for me. It's hurting because if this oxygen is off, then it's over for me.
Inako just received a backup battery from a private donor for her oxygen concentrator. This will help to operate during load shedding, but this battery can only last for an hour and a half. Inako's wish is for her home to have a solar system installed so that she does not have to go to hospital each time there is load shedding. Lubabalo Tada, SABC News, Eastern Cape.
The consequences of power cuts in healthcare facilities can indeed be varied and far-reaching, including losing power in theatre, various types of electrical equipment not working, or computer systems becoming temporarily unusable. GP Dr. Maxeke joins us to talk about how load shedding has affected his practice as well as patient care. Thank you so much for joining us today. I think we've heard from Prof. Adam about what they go through with respect to, the loss of power, this load shedding at big facilities such as tertiary and quaternary hospitals. What has this been like for you, Dr. Maxeke?
Yeah, so watching that interview, at least, my problems seem a lot smaller and a lot less serious as that. But on a patient level, it is still just as significant as and serious. So we can look at it from the impact it has on patient care and also the impact on practice from an admin point of view. And starting with just basic patient care. There's the communication, doctor. Firstly, patients are unable to call in to make appointments, especially if there's something urgent. We are unable to call patients because everything works through the switchboard. We then have to use our cell phones. Patients are usually running late for their appointments or to get here, or they sometimes can't make it because of the traffic lights and the traffic jams and that impact that the load shedding has. We are unable to do basic procedures because of the lighting and because we need equipment. We can't do basic investigation that we do an ECG. We can't do lung function tests. Patients with acute asthmatic attacks, we are unable to nebulize them or put them on oxygen. It's difficult even to do referrals because we need the telephone. It's difficult to communicate via email again because we need networks. We can't get our scripts out. Remember, we're doing a lot of telecoms. We're doing a lot of telemedicine. We rely on electricity to get emails out, to get the prescriptions out to the chemist, to receive email, to receive communication from medical aids, etc. And then even, what about lighting? We work till late hours. It gets dark fairly quickly in winter, and then we don't have good quality lighting to see. We need to look down patients' throats. We need to look in their ears, up their noses. And so if there's load shedding, we battle with. So overall, the quality of patient care is compromised. The integrity of our care is impacted. And then there's also the admin point of view. We are unable to check benefits, do authorizations, stock issues. We can't come, deliveries are late, things to get out that we need to send out. And I think one of the most critical things in terms of load shedding is the impact on the fridge and the cold care and the storage of vaccines. Vaccines are absolutely critical that they be kept cold. So if there's a break in that cold chain, the safety and integrity of the vaccine is compromised. And then I think the stress levels on the practice itself, on staff, and the frustration of working around these odd hours and the load shedding really takes an impact, or has an impact on all of us at the practice.
Have you found that you've needed to now adapt, unfortunately, with respect to getting and making this load shedding as non-impactful as you possibly can? So getting a backup generator, having to buy solar panels and having batteries, having to buy equipment that has batteries within it so that it's charged at all times. So what have you had to do in order to get yourself load shed proof?
Yeah, so we needed to get a small generator, at least to make sure that it runs basic things, the plugs for the switchboard, so that our telephones don't go down, at least basic, and the Wi-Fi is up. We had to get UPS systems to make sure that the computers have sufficient power, at least till we can shut down. We have to invest in battery-operated ENT sets. We've got these nice wall-mounted ones, so we now have to use battery-operated ones so that we can examine patients properly into their mouths and ears, noses, and throats. We need to make sure that the windows can open to allow as much lighting in as possible. We have to invest in these wall-mounted battery-operated lights that can come on when the lights go out. Because lighting is critical. And then even things like heaters. as Prof mentioned, it's extremely cold. Now your patients who are coming in, they are cold. You need to examine them. You need to have them undressed, and they are shivering and ill. They get at more risk of getting sick around that. So we really have to improvise a lot and think outside of the box just to make things as quickly as easy as possible, and then try and do as maximum appointments while we still have electricity, so that at least when the lights go out, we can concentrate on doing more admin-based things that don't need as much power as during when we have lights.
Now, this idea of exemption of healthcare providers and facilities from being load shed is a discussion that's been recurring. Do you think there'd be benefit in having hospitals, but as well as clinics and, of course, private practices from being load shed so that patients aren't affected?
No, absolutely. Obviously, especially watching Prof in that interview, the hospitals are critical and paramount, and they should be prioritized. We are probably a little lower down the food chain, but absolutely, from a patient point of view, patient care is compromised. We do have emergencies. We do need to do procedures at that particular time, and we can't we can't work around the load shedding, as it were. And so I think doctors and private clinics, private practices like ours should also be somewhere along the line of being in terms of priority, so that we can have uninterrupted power. And I think especially critical during winter. It's sad to see when we can't help kids and we can't help families. So yes, we should be somewhere up there in terms of having uninterrupted power.
Well, thank you so much for joining us, Dr. Marlon McKay, to really discuss the impact that private practices, of course, the smaller of them when compared to hospitals, are actually affected by all this load shedding. It is something that affects hospitals, clinics, as well as private practices, but more importantly, affects you at home who would need medical care and go to a facility that is currently being load shed. Of course, we continue our discussion after the break. We'll see you after that. Welcome back to Vital Science. Namhlanje sikhuluma nge-impact load shedding enayo empilweni yakho. Of course, ke sikhuluma ngendlela ibhedlele namakliniki zinganayo electricity ngesikhathi esiyidingayo ngayo mawungabe wena ke uzithola udinga ukuya ekliniki. Now, as South Africans, we're trying to cope with all the ongoing load shedding situation. Health facilities across the country are under severe pressure to maintain their day-to-day activities. Sadly, this means that sometimes a patient may be lost when oxygen or life-saving equipment isn't readily available. We're now joined by Mr. Rampelane Moroane, the Chief Director of Primary Healthcare from the National Department of Health, about the devastating impact of load shedding on Gauteng's public hospitals as well as clinics. Thank you so much for joining us, sir. I think throughout the show we've had guests that have come on and really discussed all the issues that they've highlighted. Some of these big issues are big facilities such as Charlotte Maxeke and other facilities going through load shedding. What's the department's plan with respect to getting them off the grid, or at least exempt from getting load shedded?
Good morning, Dr. Mtombeni, and good morning to the viewers at home. The matter of load shedding has been debated in several platforms, and I've been invited previously to also respond to the queries from the media. And we are just consistent in saying, one, as I think it's Dr. Mgomezulu from Bheki Mlangeni has indicated, that their hospital has the generator that's connected and it has got uninterrupted power supply, which kicks in immediately when there's power failure. It operates on diesel, and we know that that's not an ideal situation. But as a standard operating procedure for infrastructure development, all hospitals that are in our country, all of them have got generators that are running on diesel. Of course, the downside is that the diesel doesn't come very cheap these days also. But under the circumstances, I think that's how we're keeping them sustained. I mean, I listened to Dr. Martin, and the way Dr. Martin sketched it, you would realize that he actually even went far beyond just the four walls of a hospital to indicate, for an example, the impact of the load shedding on the health generally I mean, the story, very painful story of the patient that was shown in the insert here. I think it's in the Eastern Cape. People that are reliant on electricity for oxygen concentrators. You know, you can tell, I mean, it's a very sad story. So the question you're raising is whether we can be, you know, be taken off the grid, or there could be some exemption, which is what people have been proposing. And I said previously, I'm going to say now that that's actually ideal. And being ideal means, I mean, it's something that is desirable to do. But I mean, it's a matter that would have to be discussed at a much more higher level. But with regard to specific areas that you referred to, I mean, if you talk about Charlotte Maxeke, as the professor was on the call, I mean, it's a matter that's receiving attention at the highest level of government in terms of both the province and the National Department of Health. It's a matter that both the Premier and the Minister assist with, and there's a team on the ground that's working day and night to make sure that they address the issue. So that's as far as, I mean, I can respond. But I mean, I'll be able to deal with many other things that would come. But just to say to South Africans, we perhaps need to look at the issue of Charlotte Maxeke slightly different, because we know where it comes from. It's an issue of the hospital that was scattered and therefore it has been struggling. But I've just given a response on general practice with regard to hospitals, with regard to the power outages and the kind of measures that we have in place.
So we have a caller on the line now. Benny, good day.
Good day to you, Benny. Good day to you and good day to the listeners. My major concern is, okay, fine, hospital is being spoken about. What about the private sector? I'm a person that's in and out of hospital. When I'm in hospital, I'm pretty much safe. And if I have to get to hospital, to get an ambulance to me takes half an hour, 45 minutes, give or take. And at the end of the day, I mean, there's cost factors involved and all what have you. Since I was initially on the CPAP, I'm still on the CPAP machine, which I make use of at night, which is powered by electricity and nothing else. Number two, after I was discharged from hospital from COVID last year, I spent the best part of my winter going into mid-spring that I was in the hospital. I'm lucky to be alive. However, after that, I became oxygen dependent.
Yes.
And when your power goes off during load shedding, yes, for the first 10, 15 minutes, you know, I'll squash myself. I'll try and get myself there. But thereafter, what does one do? And at the end of the day, fine, I've been provided with the oxygen concentrator. That's electricity dependent. I've been provided with an oxygen bottle, which holds oxygen only for 6 hours. And after 6 hours, what happens?
It's very good questions, Benny. I think I get the gist of what you're saying. I think it highlights the importance of not being load shed, and of course the impact of load shedding on your day-to-day life, where you move from being a patient that has got some mild condition, but due to the load shedding, it actually gets exacerbated to a point where you find yourself requiring constant care and maybe even supplementation with oxygen and concentrators and things such as that. So thanks for your call. I think I'm going to relay this conversation and of course move it on to our guest from the National Department of Health. Let's continue this discussion. I mean, the idea that you've brought out is that, you know, discussions are happening and there are teams on the ground and things such as that with respect to getting hospitals and healthcare facilities off the grid, for lack of a better term. But there are provinces that actually do this. So the example of the Western Cape has been brought up, where an actual decision was made and stuff is actually being done. So what's taking so long with respect to getting things done? I think meetings and chats and discussions and you know, task teams and things such as that are great to have, but at what point do we actually just start doing something? So where do we stand and where do we sit with respect to getting things done?
Thank you very much again, Musa. You know, I mean, the matter of the load shedding, it's a metaphor. It's a national matter. I mean, we all, looking forward to the solutions that the president has announced, as solutions that are going to really come to address it. Because as per the caller, though the line wasn't very clear on my side, but I could pick up that his experience is not different from the experience of the community member from Eastern Cape, who has expressed these very serious problems, with the oxygen concentrator. You see, already when people speak in the manner that we're listening to people speak, it even takes you beyond the four walls of the hospital, as it were. It then gives you the general impact of load shedding on the life and livelihood. Dr. Martins just sketched out this matter. For an example, somebody at home who has got medicines that require a strict adherence to the cold chain. When the power goes off for 2 hours or the extended hours, they are then in trouble. Medications, in clinics, they may be affected. So robots in the streets, people that want to rush to the hospital in private cars, they may be delayed because there's traffic congestion. So they are really raising general issues. That is why, as a health sector, and also just as a people generally, we're looking forward to the solutions that have been proposed by the president. But the discussions I was talking about are very specific on specific matters, because in the latter part of your initial question, you had indicated the issue of child Maxeke. I was then saying that is a matter, it's a specific matter, it's not a general matter just of load shedding. It's a matter where a team is on the ground working on the restoration of the functionality of the health facility that was scattered, which has got its own challenges. I'm sure everybody knows, power in the fire will get started in some areas after they have just been concluded. But that's a matter for another day. So that's where I spoke about discussions. But the president in the family meeting indicated steps generally that have been taken, and health sector is going to benefit hugely from that. But I'm saying there are also ideal proposals that people are making. And these are proposals that the leadership is busy working on.
Mr. Morani, Mr. Morani, I'm just going to jump in here just for a second.
Okay.
I think the question I asked is what is making it difficult to switch on the hospitals when everyone else is switched off? Why is that specifically something that has to be discussed over and over and over again when, like I said, some provinces find it very easy to switch on the hospitals when everyone else is off? So why is Gauteng and Mpumalanga and Limpopo, why do those provinces find themselves having to, working very hard to solve a very simple issue of keeping the hospitals on?
I would want to avoid responding because I'll tell you why, Musale, with due respect. Electricity is managed by different outside the Department of Health. I can only deal with matters that we are competent in dealing with in the Department of Health. The discussions between various sectors and the Department of Minerals and Energy and ESCOM and everybody else, it's a matter that unfortunately I'm not competent to deal with. But I do understand the frustration that people are expressing. I do understand the question that you are raising. Maybe from what you said, you think it shouldn't take long. But I do tell you that now, that some solutions are being mooted. And with solutions, once they come in, I'm sure they'll be able to bring very great relief to all of us, both in the health sector and generally for our normal livelihoods.
All right, we've got another caller, Maxime. Good day, Maxime. Thank you so much for your call. What would you like to say?
For us, really, it's just to say we understand.
Okay. Maxime seems to have put us on hold. It's not an issue. Let's go back to our conversation. I think the other thing I would like to look at is this idea of staff. I don't know if you're privy to this information, but are staff members able to deal with the work or do the work when the power is out? What have you been hearing, and what does that look like?
I spoke about the supply of energy, particularly for commodities, but the supply goes to the facilities so that the staff can continue working. The reason why we put them on the uninterrupted power supply is to make sure that our own staff are able to continue rendering the service for the hours when there's no power. So the staff, yes, could be affected in the same way that commodities are, but the supply that we are working on, that we've provided it through the generators, supplies energy for both the staff and the commodities alike. so that the work continues to be carried out and that patients continue to receive the care that they should be able to receive. So that's basically what we are doing on the ground.
Now, a big thing that is naturally reported when people speak about this issue of load shedding is the cost of the load shedding in terms of productivity, in terms of time, but of course, financially as well. Now, with hospitals such as Chris Hani Baragwanath reporting the use of more than 3 million rand worth of diesel in 1 month to sort of make the impact of load shedding not felt as much. What do the numbers actually look like with respect to other facilities? I'm sure as a province and nationally, these numbers go into the tens of millions with respect to just getting backup power. So are there no better solutions to making sure that, hospitals and facilities such as that are able to provide services without necessarily incurring budget constraints such as the big tax bill that comes from the use of diesel and things such as that?
The cost of providing or using any alternative means, such as the one of using diesel generators, which in other areas, this becomes an alternative that's used when there's no power. That's what we're currently using, and we have found it to be a relatively, one, easy to maintain system, but two, easy to operate, but thirdly, in terms of the overall costs, is the one that's fairly affordable. And I mean, I've started with it at the beginning by saying, diesel doesn't come that cheap also, but that is currently the system that we are using, and it has proven to be relatively effective. But of course, if there are new initiatives, I mean, the teams from our infrastructure would be able to look at those. But for now, we haven't had any challenges with regard to breakdown of those generators not starting. If they are not able to start, the technical teams on the ground are able to respond. But currently, that's how we've been sustaining the system. But we know it's not an ideal situation. We obviously would want to have a situation where there's no power failure at all.
Well, thank you so much for your insights, sir, for really addressing and sort of looking at what the plans could potentially be from the National Department of Health with respect to helping and assisting hospitals and clinics and other facilities when load shedding does come around. One thing we do know is that it is here to stay. It is here for a while, and we hopefully, we'll see something come to fruition with respect to the presidential plan to get electricity back to where we would like it to be, to basically having no load shedding. Thank you to you for joining us today and looking at the impact of load shedding on your lives. I think this is one of those issues that affects every single one of us, but more importantly affects those that are sick and require electricity at all times more drastically than other people. This has been Vital Signs. Thank you for joining, and we'll see you again next week.